Smiling faces. Good morning. Good morning. All right. My name is Orlando Watkins. I serve as Vice President and Chief Program Officer here at the Boston Foundation. It is a great pleasure to welcome you all to this event. Promises in Practice, the Momnibus bill, 1 year in. How did I do, Danubia? All right. Walking in this morning, with the balloons and the energy, it felt like I was walking into a 1-year-old's birthday party. And I knew the balloons were going to be here because I signed the invoice for the balloons, but the energy, the joy, the smiling faces, given all that we are dealing with as a community, was appreciated, Danubia, and the right thing to do to celebrate the success of this effort. Today is certainly a chance to celebrate the wins we've made, especially given the challenges of birthing families in communities that we serve. And again, what a milestone this is. The bill passed unanimously in the House and by voice vote in the Senate, meaning there was no opposition. That kind of consensus speaks to how vital maternal health equity is and how much momentum we have built. And with all the people in this room, we have built real momentum. And so today is about a celebration, but it's also a call to action. This is about more than health metrics. It ensures that every birthing person has agency, dignity, and a respectful care experience. Our work is about co-creating a system that is equitable, inclusive, mindful, and considers the entire birthing experience. But we know that progress is never guaranteed. Across this country, we are seeing efforts to threaten the rollback of hard-won gains, efforts that could halt the forward motion of programs designed to protect birthing people and families. These moments remind us why vigilance matters, because every inch of progress must be defended. At the Boston Foundation, we see maternal health as one of our core bodies of work in our child well-being work. When mothers and birthing people thrive, children, families, and communities thrive. That's why we invest in community-led solutions and partnerships that strengthen the systems supporting young children and their families. So before I turn it over, I want to thank everyone in this room, but I first want to thank my colleague, Danubia Camargo Silva, who leads we can give a round of applause for that. Her incredible leadership work, advocacy, how she shows up as a parent and a mother for this work has taught this foundation a lot about how to listen deeply to community and those we serve. So I'm forever grateful for your leadership, my friend. I also want to thank the advocates, the policymakers, the funders, the parents, the health workers, the nonprofits, the community leaders, all represented in this room, for being a part of this movement. So let's keep fighting. We've got a lot of work to do. The bill's just one step. And the Boston Foundation is here to fight with you shoulder to shoulder. So it is now my pleasure to introduce a true champion of equity and justice, whose leadership continues to shape maternal health in Massachusetts, Senator Liz Miranda.
Good morning, everybody. This is a beautiful room. I'm slated to speak for about 5 to 10 minutes, and like true politicians, we tend to go over. But today, I also have to go speak at Cathedral High School, so I'm going to try to make this as concise as possible. But just want to thank, I've known Danubia for a long time, and we're all in the trenches in community organizing work, so it's a pleasure to be here. When you ask, I say yes, because you're going to ask me again, and so I can't say no. And I just want to thank the Boston Foundation because for those of you that don't know, about 15 years ago, I worked here. And I thought I was going to go down the philanthropy track. I was really interested in seeing how foundations could change communities because I grew up in the Dudley Triangle. There's 2 movies about my neighborhood. It's called Holding Ground and Gaining Ground, and there's a book called Streets of Hope. And my neighborhood was transformed by multi-year grants by the Annie E. Casey Foundation. So in the 90s and the 80s and 90s, the Annie E. Casey Foundation picked cities and towns at the cusp of transformation and invested in these communities and invested in people. And their investment in the Dudley Street Neighborhood Initiative is what created people like me, like John Barrows, like the Dorsina family, as we were young people growing up in a neighborhood that was environmentally unjust. But we knew we had the power to organize and come together. And today, a neighborhood that had 1,400 parcels of vacant land only has 2. And it's a beautiful thing to wake up from my home that I own and walk up the street and just see these 2 lots and know that in 2 years, that'll be finally complete, as a little girl who walked in a neighborhood and thought they were parks. And so I understood the power of foundations. And so when I came here, I worked on summer safety grants and grassroots grants, because I also believe that small amounts of money to organizations that can take that money and do great things could make a huge difference in young people's lives. I was a product of my town, teen empowerment, the Boys and Girls Club, BCYF centers. And so I knew that if we invested in young people in their organizations where they were taught great things, they were loved, that they could aspire to do great things, even greater things than they were doing in their teenage years. And after naming Street Safe and building that initiative, I decided to leave. It was too high up. I was like, I got to get back on the ground. And so I went to become an entrepreneur and an educator, and still became a personal philanthropist. But I knew the foundation had too many constraints for me. So I now know that the foundation has chilled out a bit, and they got some great troublemakers here. So hey, who knows? Maybe in a as I sunset in my career, we want to think about this. But oh, it's great. Because I believe fundamentally there's one important thing that has led me to work on maternal health, is that a lot of times foundations and organizations and leaders talk about children's and families thriving. But what does that really mean? Like, if kids can't survive, if they don't live in a safe neighborhood, if they don't have enough food to eat, if they're worried about their parents being picked up by ICE, these kids are not thriving. And so it's important for us that are in these positions and working at these organizations or nonprofits to be thinking about, if that is our ultimate goal, that we can have safe, happy kids and we can have a safe, healthy birthing experience, that we actually have to do the thing and name the thing that is happening because we can't avoid it. And what was happening in Massachusetts was that women were dying, and I did not know. And for those of you that don't know my story, I'm not gonna belabor you today, but I literally did not know that we were in a maternal health crisis in the Commonwealth of Massachusetts, and I wouldn't have believed you if you had told me in 2018 and 2019, because I believe I live in the best state for healthcare, right? I know that I live in the best state for biotech education, for life sciences, and arguably the best place for public health in the whole world, right? And I said to myself, when March of Dimes released their report that year, and we were in a room, and it was all women, and I looked at Nika Lugardo, who was the other Black representative, and now there were 3 Black women out of 200, and I said, excuse my language, oh shit, like, this is really happening to us. And I did not want that experience, I hadn't been a mother yet, to be something that I would live through. And then I thought about my mom, my sister, and I thought about my friends, one who had birth trauma so bad that she almost died, and another one who had to get a doula in her last month, and another one who had to get a forced C-section, even though she didn't want to have a C-section. Her doctor told her she should have got a C-section, so she did, and it had multiple complications. All these stories of women came to me, and what started off as just a curiosity and just anger and rage, because what was happening in Massachusetts was racism. Just plain racism, and structural and systemic in our hospitals and the way we teach doctors, in our community health centers. And this was permeating to women and birthing people not having the autonomy and the agency to be able to say, no, I don't want that. Or no, I think we deserve something better. So it only took us 6 years. And I'm really proud that in the last year when we elected, now it's more than last year, when we elected Governor Healy and Lieutenant Governor Driscoll, one thing that was really interesting about them is that they restudied the issue. Well, I didn't think they needed to, but they did. But when they came back with us that actually things had gotten worse in these last 6 years, I was devastated. I was one of those people thinking to myself, you know, I thought the commission did a lot of work. I thought once we made insurance coverage after 60 days, that's a great work. After we put doulas in the Mass Health waiver, that was great work, and we were gonna see automatic outcomes, but we did not. And actually what the governor came back through the Department of Public Health said to us was that it had nearly doubled mortality and morbidity for Black women in Massachusetts. And I just was like, we've got to get this done. And so we worked together. I want to thank my partner in the House, Marjorie Decker, representative. She was chair of the Public Health Committee. I want to thank other Senate leaders like Friedman and Becca Rausch, who helped, and Lovely, who helped on the Senate side, and Brandy Fluker-Reed, who was another Black woman who was in the House of Representatives. And all of us knew that we needed to do something big. And so we did an omnibus bill that didn't have everything, but right now it's the most comprehensive maternal health bill in the nation, so we should give it up to ourselves. And really focuses on 10 areas, but the 3 top areas that I think: birth centers, midwives, and doulas. Like, those 3 things save lives. And we don't have to study it again and again for us to know that when there is a midwife present, when there's a doula present, when you have options to give birth, not just in a hospital, and particularly on this side of the state, that your outcomes improve, particularly for people who are in rural communities, people who are in urban centers, people that have pregnancies that they want to have a more joyous experience than have it in a hospital. So we are excited about this, but bills passing is just the first step. Implementation, which we are in right now, is actually the most important step. And I like to quote Brian Russian, a former state rep for 36 years. He used to say, if it don't got no money, then it don't make sense, right? And so the idea of like funding the initiatives that we need to have, because we know it works. Once doulas were able to practice and be able to be available for people on Mass Health, hundreds signed up. Now we got to pay them what they're worth, right? Now we got to make sure that private insurance, folks that have private insurance like me, I have Harvard Pilgrim, and making sure that I have the same access, that is another step. We did a lot on postpartum depression, but now we actually have to fund the organizations and the work so that no birthing person will go to a hospital or a community space and be turned away and not acknowledged for their pain that they're suffering. They're not crazy. As someone who has had 3 sisters, like literally in the last 6 years while working on this bill with postpartum depression, one who lost her child that led me to be the catalyst for this bill, and then one who had a miscarriage and had a rainbow baby but never forgot her baby that she lost, and one sister who we have just lost our brother 3 months ago, and just giving birth and being sensitive and having an 8-month-old at home and then losing a sibling has been really hard. And so we know that people are suffering in silence, and they have the means, some of them, and they can't even ask for help because of the shame and stigma that is still out there. So I encourage the foundation to invest deeply and think about this issue now that we've talked about it so many times. Like, let's think about, how do we pull the levers now? Let's not wait 2 years. And Mass Health is working really hard. The Department of Mental Health, the Department of Public Health, your organizations are working hard, but we don't have time. A lot of times in Massachusetts, we think we're exceptional. We think we're the best. We are at times, but we shouldn't let that stop us from being better, right? Let us push the needle now. We're not gonna wait a year, 2 years, or 3 years for this entirety of this implementation. Like, the bill's passed, we've gotta save lives now, and so we've gotta put our feet to the rubber and make sure that we have this sort of fierce urgency of right now, so that we can make sure that the State House is doing our part, but the administrative offices and the executive offices are also doing their part, so that it can trickle down to community. Right? I don't want to hear the news again and see a mom take her own life or take the life of her children because she could not get the help that she deserved. I don't want 1 in 3 Black women to go into any Boston hospital and have to have a C-section. I don't want women who have private insurance who are still dealing with the same things in our communities as other people are, just because we have different insurance carriers, not being able to get a doula to help us through our services, and midwives still not being respected in hospitals. Right? I hear stories, and us not being able to have a birth center on this part of the state. I'm not going to be able to go to Northampton. We've got to make sure that in the city of Boston, it's somewhere, and so that we can make sure that people like you, people like me, can be able to access that. So thank you all for just being a super good audience, and just know that we didn't do this alone. Many people in this room helped to educate me, help usher me, help challenge me, push the state legislature when they were not moving fast enough or weren't doing the right thing, because there are other lobbying organizations that are really strong and very powerful. And so we came together to really work on creating something that I'm really proud of. So thank you. All right.
All right, everyone. And now, we've been talking about this Momnibus bills, but I think everybody here must know, but we got to set the context. So thank you so much, Senator Liz Miranda, for your powerful words and for your unwavering commitment to advancing maternal health equity across Massachusetts and the Commonwealth. Your leadership and deep care for your community continues to inspire all of us. The passage of the bill, with the unanimous support, continue to inspire all of us. The passage, it was a voice vote in the Senate and unanimous support in the House, which ensures that the bipartisan, this is truly a bipartisan issue. And it's clear that ensuring the health and dignity of birthing people, it matters to all of our legislators. Thank you for being here today. Thank you. Now, to help us better understand the Momnibus bill and the progress he made so far, and what it still needs to happen, I am pleased to welcome Dr. Elaine Fitzgerald-Lewis. She is the director of the Bureau of Family and Health and Nutrition at the Massachusetts Department of Public Health. Dr. Fitzgerald-Lewis has a remarkable track record of accomplishments, which we've highlighted in the bios shared prior to today's event. She brings deep experience and insight to this conversation. And we are grateful for her leadership and of her team. She could not do this alone in advancing this work, and to keep the intention, because sometimes the intention behind the bill gets lost in implementation, but their heart is in the right place. When I first heard them speaking, I was just like, I've never seen this before. So I just want to say that I was amazed. The word amazing nowadays, it's so hard to use it. It lost its magic. But I'm bringing the magic back. I'm reclaiming the magic. I was amazed. And but after the presentation, we'll be joined by a panel of experts for a rich discussion on this topic, and will be followed by a Q&A as well. So thank you. Welcome, Elaine.
Good morning, everyone. All right. Before I begin, I'd like to extend an opportunity to say thank you. Our deep gratitude to the Boston Foundation for graciously hosting us today and creating this powerful space for reflection, celebration, and continued commitment. And your intentional support for maternal health and birth equity has really helped to bring voices from across our ecosystem together. So thank you for creating this gathering space that allows us to have shared purpose and vision. I also want to recognize our valued partners for systems change, from community-based partners, advocates, legislators, and state agencies. Your unwavering commitment to inform and shape policies that reflect the needs of parents, caregivers, and communities truly is inspiring, and it's what supports us to continue to show up every day. Again, I'm Elaine Fitzgerald-Lewis, and I have the deep honor of serving as the director of the Bureau of Family Health and Nutrition, as well as the state Title V Maternal and Child Health Director. And today we come together not only to celebrate progress, but to also highlight the actionable pathways that aim to strengthen maternal and child health systems, ensuring that every family in Massachusetts receives the support they deserve. So I'd like to begin with a brief introduction of the Bureau, and for those who may be unfamiliar with our work. And this will provide an important context of our mission, the priorities, and the role that we hold in shaping maternal and child health policies and programs in Massachusetts. Next, I'll provide an overview of the maternal health law signed by Governor Healy, and I'll highlight the key provisions of this landmark legislation and offer a high-level summary of our progress in implementing core activities. And then I'll share more deeply several of our signature initiatives that are central to advancing health equity, much of what Liz Miranda had just shared. So focusing on our birth centers and certified professional midwife regulations that are aimed at strengthening access and safety in midwifery care. I'll go into our public health campaign on pregnancy loss, raising awareness and providing vital education and support for families. Our Maternal Mortality and Morbidity Review Committee, which is expanding our authority and capacity to drive systemic change, and our Universal Home Visiting Program, ensuring every family has access to early comprehensive support. And through these initiatives, we are working to break down systemic barriers, enhance accountability, and ensure that every birthing person and family has access to the care and resources that they need. So the Bureau of Family Health and Nutrition, also known as BFAN, is one of 8 bureaus in the Department of Public Health. We also serve as the home for the state's Title V Maternal and Child Health Block Grant, and in this capacity, we develop, implement, and evaluate policies and programs for pregnant people, parents, infants and children and youth, including those with special health care needs, serving over 1 million families each year, and that number continues to grow. The Bureau encompasses 6 divisions and nearly 50 distinct programs and initiatives, all dedicated to supporting families across Massachusetts. This effort spans a wide range of services, from nutrition services through WIC and breastfeeding assistance, to the oversight of our statewide early intervention program, to community-based home visiting initiatives. We also lead maternal health services that foster strong parent-child bonds and drive systems change through efforts like our perinatal neonatal quality improvement network, which partners with all birthing hospitals to enhance care and outcomes. Together, these programs reflect the Bureau's vital role in building and sustaining healthier future for families. We also provide comprehensive programs for children and youth with special health care needs and maintain a robust infrastructure that drives surveillance, the data that help to inform and shed light on where the disparities and the gaps exist. That information, driven by maternal and child health practitioners and researchers, has really allowed us to continue to move this work forward. It ensures a data-driven approach to serving families with intentionality, care, respect, and inclusion. And with the passing of the maternal health law, many of its key initiatives are housed within my bureau that supports implementation and reinforces our role in advancing maternal and child health equity. This broad and deeply integrated portfolio uniquely positions the Bureau and the department to better support coordinated systems of care, ensuring families receive seamless, responsive, and equitable support. So let's explore what's in the maternal health law, and most importantly, what it means for families across the Commonwealth. The landmark legislation and act promoting access to midwifery care and out-of-hospital birth options is designed to strengthen maternal health practices and expand coverage for critical services. Its primary goal is to ensure greater access to midwifery care, birth centers, doula services, and comprehensive screening and treatment for postpartum depression. Simply put, our aim is that birthing families across Massachusetts receive the support they need for safer and more equitable maternal health outcomes. This slide and the next offers a high-level overview of our progress implementing several key initiatives led by DPH in collaboration with state agencies and partners. Afterwards, I'll dive more deeply into the areas that are marked with an asterisk. Because of our limited time, we won't be able to go into depth, but my team and I are more than happy to connect with folks offline. Now, over the past year, dedicated public health practitioners and MCH leaders have worked tirelessly to implement the bill, including drafting regulations and procedures, building capacity, strengthening collaborative partnerships, and engaging key stakeholders to drive meaningful systems change. A crucial component of this work has been securing the necessary funding and infrastructure to ensure accountability. As Senator Miranda just said, we can't do this work without funding. And it didn't come with funding. So part of this was us realigning what we currently have in hand while partnering with so many others to help us address the complex needs of our communities while getting the dollars where they need to go, because all of this change takes time. And so with that, there's a lot of groundbreaking work that we already were working on that allowed us to move quickly into action and reach major milestones, including finalizing birth center regulations and expanding the authority of the Maternal Mortality and Morbidity Review Committee. We have developed and disseminated guidelines for the use of donor milk, which requires breast milk to come from qualified milk banks, meeting DPH safety and quality standards. Additionally, the Legislative Maternal Health Task Force, co-led by DPH and the Health Policy Commission, has been established and actively meeting. This task force is currently developing a comprehensive report on how families across Massachusetts are faring when it comes to accessing maternal health services and ensuring patient safety. This report will examine the availability and geographic distribution of maternal health services, the financial investments in maternal care across the state, and the impact of past service closures on community access outcomes. Our goal is to provide a clear picture of the current landscape and identify actionable opportunities to strengthen care for families statewide. The report will integrate quantitative research, which was already completed in October, and the qualitative research component will be finalized in the winter. So much more to come on this. Beyond these milestones, several key initiatives are also advancing. We've launched 2 websites for families and providers. One is a digital resource center designed to provide comprehensive resources and supports for individuals experiencing perinatal mood and anxiety disorders. The website is now live, offering a centralized hub for education, guidance, connection to services. Information available includes support to identify signs and symptoms for perinatal mood and anxiety disorders, screening and treatment, and access to support groups. And a second website was developed to provide birthing families with critical information and resources on pregnancy loss. Additional initiatives currently underway include the development and implementation of regulations for certified professional midwives, as well as the expansion of home visiting programs, both of which I'll explore more details shortly. At a high level, we're also drafting regulations for lactation consultation licensure, which has been approved by the Board of Allied Professionals. This licensure will help standardize credentials and training for those providing clinical lactation care and support consistent reimbursement for their services. In parallel, we recently convened a 2-day breastfeeding strategy session with cross-sector partners to explore how the state can better support nursing mothers in achieving their breastfeeding goals and advancing maternal and infant health outcomes. We are working to establish a Fetal and Infant Mortality Review Committee, or FEMR, that would review fetal and infant deaths to help inform policy recommendations, strengthen family supports, and reduce disparities. As part of this effort, we're exploring existing legal authority for conducting a FEMR, engaging in detailed project planning, identifying and addressing funding gaps, about $350,000 if anyone has dollars out there, and assessing available data sources for us. As a foundational step, we're developing a comprehensive data report on fetal deaths in Massachusetts to better understand the current context and guide future action. And that's anticipated later in the summer of 2026. Lastly, we're excited to share that a new grant program is launching to support perinatal mental health and address substance use disorders. We'll be distributing $220,000 to community-based organizations across the state with a formal request for proposals set to be released in the coming month. More details will be shared, and we look forward to partnering with many organizations across the state. As we advance these critical initiatives, securing long-term funding is essential. Without it, we lose momentum and miss the chance to fully integrate these efforts into a stronger, more equitable maternal health system for families across the state. Now, I want to dive more deeply into some of these important initiatives, starting with our certified professional midwives. CPMs play an essential role in providing maternity and perinatal care in community settings. Their model of care is deeply centered in family and community engagement, attending births, both at home and in community birth centers. Research consistently shows that individuals who receive care from CPMs and in birth centers experience fewer medical interventions, lower rates of cesarean sections, as well as higher patient satisfaction, improved breastfeeding outcomes, and greater likelihood of physiological birth. Yet, in Massachusetts, we only have one birth center right now and approximately 50 practicing CPMs. This number of CPMs is increasing slowly, and we need ongoing focus to address workforce gaps in birth center access. The Maternal Health Bill mandated the formal regulation and integration of CPMs into our state's healthcare system, expanding access and stronger oversight of midwifery care. A key step in the process was the creation of the Board of Registration in Midwifery within DPH, a 9-member board carefully constituted to bring diverse expertise to the table and charged with developing regulations and defining the scope of practice for CPMs in the state. The board is actively working towards establishing temporary licensure pathways to allow CPMs to practice under regulatory oversight, ensuring CPMs have access to essential medications, and finalizing permanent licensure and comprehensive regulations with a goal of full implementation by the end of the year, next year. Another critical component of this work is the Community Birth Integration Plan developed by the board, which focuses on creating guidelines and protocols for care transfers across the state, collaborating with hospitals and midwives to conduct transport drills, ensuring obstetric patients receive seamless care in cases requiring higher medical intervention. Additionally, new birth center regulations will allow CPMs to be employed and further strengthen birth center care, supporting the expansion of community-based birth options. In tandem with efforts to grow our CPM workforce, the Maternal Health Bill empowers us to take bold, strategic steps to expand and fortify birth center care across the state. This means more families can access safe, supportive, and personalized birthing options rooted in autonomy, dignity, and community-based care. At the heart of our work here is balancing access with safety. Our primary goal has been to thoroughly review and update existing regulations to ensure birth centers remain accessible and responsive while upholding the highest standards of care and patient safety. These updated regulations include CPMs as qualified providers and ensures critical safeguards, such as a robust and clear transfer plan for when birthing individuals or newborns require a high level of care, and defined risk assessment protocols, ensuring that individuals who risk out of birth center care during prenatal care of labor receive the support they need in the most appropriate setting. Earlier this year, in February 2025, these regulations were formally approved for promulgation, a significant milestone in strengthening maternal health practices. But regulatory updates alone are not enough. We must ensure that birth centers can thrive and sustain their services long-term. So that's why in fiscal year 2025, DPH has distributed $2.8 million in grants to support the development and sustainability of birth centers across the state. This funding secured through one-time ARPA allocations and legislative earmarks represents an ongoing commitment to expanding birthing options and ensuring every family in Massachusetts has equitable access to safe, high-quality maternal care. And recognizing the need for sustained infrastructure, on October 24th, we posted requests for proposals to distribute another $1 million to support opening and expanding birth centers across the state. The goal of this funding is to improve access for all residents to receive care at a birth center if they wish to. We know that birth centers improve both birth outcomes and the experience of care, as well as improving breastfeeding rates. With these advancements, Massachusetts is leading the way in reimagining maternal health, not only expanding choices, but ensuring families receive care that's dignified, supported, and rooted in equity. A core component of the maternal health law is ensuring that families have access to compassionate, evidence-based information about pregnancy loss. Pregnancy loss has a profound impact on individuals and families, and our commitment is to provide resources that are informative, supportive, and culturally sensitive. DPH is developing a statewide campaign to increase awareness of pregnancy loss and its prevalence here in the state. That campaign will also promote mental health support, necessary medical interventions, and grief resources, ensuring information is accessible in multiple languages. We have a pregnancy loss website that I mentioned, and it serves as a central hub for families and providers, offering guidance, resources, and supports for those experiencing loss. However, to fully realize the reach and the impact of this campaign, additional funding is essential. While we are moving forward with foundational efforts, a comprehensive and continuous media campaign requires sustained investment. We want to be able to expand outreach, maintain visibility, and ensure long-term engagement. Recognizing this need, DPH is actively working to secure funding to strengthen and sustain this critical work. And in parallel, in an effort to support the healthy birth of all babies, Massachusetts has been one of 3 states funded by the CDC since 2014 to participate in the stillbirth study, a case-control study aimed at identifying causes of stillbirth. And to further advance stillbirth prevention, DPH is working to secure legal authority to formally monitor stillbirth occurrences, enabling the state to track trends, investigate potential causes, and implement targeted interventions to reduce risk. We're also now in our 3rd consecutive year of promoting the Count the Kicks stillbirth prevention campaign, which empowers pregnant individuals to monitor fetal movements and seek medical care if changes occur. Stillbirth affects 1 in every 238 pregnancies in Massachusetts, equating to approximately 285 fetal losses annually. And to put that into perspective, that's the equivalent of 14 kindergarten classrooms going unfilled each year. A heartbreaking reality that underscores the urgency of prevention and intervention efforts. Significant racial disparities persist, with pregnant individuals of color experiencing far higher rates of stillbirth than their white counterparts. Yet research shows that nearly 30% of stillbirths can be prevented by raising awareness and monitoring fetal movement patterns in the 3rd trimester. For those unfamiliar with Count the Kicks, it's a stillbirth prevention campaign that equips pregnant parents with simple, powerful tools to track fetal movements, notice changes, and seek timely medical care. Through accessible resources, provider partnerships, and community education, Count the Kicks initiative is working to reduce stillbirth rates across Massachusetts, giving expectant families the best possible chance for a safe and healthy birth. Together, these initiatives reinforce our commitment to equipping families with the knowledge, tools, and support they need to navigate pregnancy loss and prevent stillbirth through education, public health action, and systemic change. We've also made significant progress here in the state, strengthening maternal mortality and morbidity review, a critical step in ensuring safe, more equitable maternal health outcomes across the Commonwealth. And we've demonstrated this in a number of ways. First, our journey has been shaped by collaboration between legislators, the governor, secretary, and an array of dedicated partners. A turning point happened in FY24 when amendments to the Massachusetts General Law formally established the Maternal Mortality and Morbidity Review Committee and therefore secured $350,000 in annual state funding, giving us the sustainable funds that we need in order to support this committee to continue to operate with efficiency and speed. The Maternal Health Bill took this a step further, expanding the MMRC's authority, requiring state agencies, healthcare facilities, and providers to comply with record requests, ensuring access to information needed to improve maternal health policies and interventions. Second, under the leadership of DPH Commissioner Goldstein, we have built a strong, diverse committee, appointing 26 legislatively specified members to the committee, ensuring greater community representation and governance oversight. Third, we've demonstrated remarkable performance improvements, with 87% of pregnancy-associated deaths reviewed within 2 years, a significant increase from just 22% in FY23, demonstrating our commitment to timeliness, accountability, and action-driven maternal health solutions. The findings that come out of the MMRC have been translated into tangible improvements in maternal health care, including expanding remote blood pressure monitoring to improve postpartum care and prevent complications, standardizing maternal care levels through new regulatory processes, increasing the number of birth centers statewide via regulatory enhancements, and implementing mental health bundles to enhance perinatal care for high-risk patients. We're also committed to advancing maternal health equity beyond the clinic. Data has driven key policy shifts to promote equity and accessibility, including expanding doula access with certification pathways and Medicaid reimbursement to make doula care more widely available, refining child welfare policies, limiting 51A filings for mothers on medication-assisted treatment unless other concerns exist, and connecting remote blood pressure monitoring patients to Welcome Family, a nurse home visiting program designed to provide enhanced follow-up care and wraparound support. Finally, governance and transparency remain at the core of our strategy to ensure continuity and accountability. We've established a full-time coordinator to oversee all aspects of the work. We've completed 2 comprehensive reports summarizing the committee findings and sharing data-driven insights with clinical and community-based partners. These achievements would not have been possible without Title V funding, state investment, policy leadership, and the dedication of so many partners. Together, we are strengthening maternal health oversight, advancing public health strategies, and improving care delivery for families across Massachusetts. And the final initiative I want to take a moment to share is the expansion of the statewide Universal Home Visiting Program to meet objectives for the Universal Postpartum Home Visiting provision in statute. DPH will expand Welcome Family program statewide. Welcome Family is an established, evidence-based postpartum home visiting program implemented in select Massachusetts communities since 2013 and funded through our federal resource of Maternal, Infant, and Early Childhood Home Visiting Grant Program. The Racial Inequities in Maternal Health Commission's report that Senator Miranda referenced earlier identified Welcome Family as a strategy to address inequities in maternal health by closing the access gap to postpartum care and providing comprehensive information during a crucial period. Expanding Welcome Family statewide will ensure that every birthing person has access to at least one home visit within 8 weeks postpartum, promoting the child's health and family's well-being. And we all recognize this is too late for some, and that does mean that we will continue our effort to engage families as early as possible in the prenatal period. However, through this initiative, DPH is working diligently to establish a statewide system and clear qualifications for programs to become qualified providers in Welcome Family. This requires scaling the program from 6 communities and 2,400 visits per year to all communities in Massachusetts and 68,000 births per year. So as you can imagine, that's a sizable challenge, but our team is up for it. We are working diligently to develop the infrastructure, partner with A&F to identify funding, collaborating with MassHealth, and engaging families, nurses, and other key partners to inform the design of the system and develop operational standards. Expansion of Welcome Family also aligns with another state priority, and that's to raise awareness and access to the other home visiting programs that span across the perinatal period. And in addition to Welcome Family, the Bureau is home to an array of home visiting programs that span from pregnancy up through 5 years postpartum. We're also working on a public awareness campaign so that more families and providers are aware of and can access voluntary home visiting programs that meet their needs. As I close, I want to leave you with the voice of a new member. Her experience is a powerful reminder of why this work matters. She shared, "It is so hard and lonely those first few weeks with a new baby." And the nurse was so supportive, helpful, and genuinely cared for how I was doing, not just the baby. This was exactly what I needed, someone to talk to with experience who would give me immense amounts of advice and tips to cope with a new baby. This sentiment is the heart of maternal and infant health, ensuring that every family feels supported, heard, and surrounded by trusted relationships in their most vulnerable moments. The systems we build, the policies we advance, and the care we provide must reflect this fundamental truth. No one should navigate this journey alone. Through continued investment, collaboration, and commitment, we can ensure that every parent, every baby, every family has the resources, care, and compassion they deserve. Thank you, truly, for the opportunity to be part of this important event. The work of maternal child health is complex, but one thing is clear: lasting systemic change is only possible when we come together. If you are a maternal and child health champion and we have not yet connected, my team and I at the Bureau of Family Health and Nutrition welcome the opportunity to collaborate. Please reach out. Let's combine our expertise, align our efforts, and build partnerships that advance equity, expand access, and improve outcomes for all families across Massachusetts. Together, I truly believe we can drive meaningful progress and ensure all families get the support that they need and they deserve. Thank you. We really appreciate all of the work that you've done, Danubia and the Boston Foundation, to support us, to bring us together. We really look forward to continuing our work alongside all of you. Thank you.
All right, everyone. Thank you so much, Elaine. Dr. Fitzgerald Lewis, for grounding us in the progress made 1 year after the passage of the bill, and for outlining what's been achieved and what still lies ahead. There's a lot of work in progress, which I loved to see. And to continue the conversation, I am thrilled to be joined by a remarkable panel of leaders who bring both expertise and lived experience to this work. So without further ado, I would like to invite Aurora Mendy Adiabo. She's a doula, a nonprofit strategy consultant, a funder, and a servant leader with the Greater Boston Birth Equity Coalition. Emily Anesta, she's the president of the Bay State Birth Coalition. Ginny Miller, she came really far this morning, guys. She's a certified nurse and midwife and owner of the Seven Sisters Midwifery, the only standing birth center in Massachusetts right now. And Reena Singh, she's the Senior Program Officer of Blue Cross Blue Shield of Massachusetts Foundation. And together, we'll explore how the Momnibus bill translates into action, how it's showing up in communities, in clinical and birth settings, and in systems that support families. After our discussion, we'll open the floor for questions. and a friendly reminder, please ask real questions. This is not the time to pitch your work or organization. We can always connect offline for that. Also, there's truly no such thing as a silly question. You don't need to sound polished or over technical. There were times I had really pressing questions and I didn't ask it because I was afraid I wouldn't sound smart. And this is a judgment-free zone. If something sparks your curiosity and needs clarification, please ask. And chances are, others are wondering the same thing. And join me. Thank you. All right, I know we are pressed on time, but we needed all of the information that we had this morning, and they were just as critical. I guess we'll just have to speak less, note to self. But the very first question that I have is, it's been just over a year since the passage of the bill. It's a historical milestone, if we could all agree. But from where you sit, because we all have special places and contributions for this space, what progress feels most meaningful, and what early lessons are emerging about how real change takes hold across systems? And we can start just from Jeannie down that way and make our way down.
So, as being the owner of the only freestanding birth center in Massachusetts, we've been open 5.5 years. This bill has helped us look for the future. We had to go through 5 years of creating the birth center and getting through regulations that were pretty onerous, but we did. And so I can see that it's going to be better for future birth centers, potential birth centers. Our biggest struggle is reimbursement. Midwives are not paid the same as physicians for the same exact procedures and codes. And there's also insurance companies don't know how to look at us, and the coding that is done for every single birth center and every single procedure in the birth center is different with every single insurance company. So I have a staff of 10, and one person and a billing company spends most of their time dealing with denials, wrong codes, all kinds of insurance reimbursement stuff. And a lot of times it just gets lost and we never get paid. So we've been running in a deficit since we started. The grants from the state have helped us stay open. We did not need grants for infrastructure because we had already built our building and we're well in existence. But it does help with some parts of that, and it also helps with funding, billing people, essentially, to figure out how to deal with that kind of stuff. So we're doing the work. We've had 800 families come through, have their babies. Our cesarean rate is about 6% if you labor with us. Our breastfeeding rate is 100%. Our insurance base is 48% is Mass Health. 28% of our families identify as Black, and so we're doing it. But we need help, and we need support financially. And it's a problem that's all across the country with freestanding birth centers. There's in San Diego this year, 3 are closing. I mean, there's just many birth centers who try over and over and are driven and passionate, but if you can't pay your staff and you can't get people to come and work, and it's a different kind of work. You have to be very autonomous, you have to be very independent, you're there alone at 3 in the morning, and you have to be of a certain ilk to do that, and you don't get paid as much. So, and you're on call so much more. So it's a very different lifestyle, and it's not for everyone. So. but I'm hopeful.
Thank you, Jenny.
Yeah.
Me next? All right. Well, thanks, Jenny, for sharing the realities that you're facing. I'll say that you know, it wasn't even a few weeks after the maternal health law passed last year that I was hearing from midwives and birth center, you know, hopeful birth center operators that they were worried, how are we actually going to do this financially and make it work? But I just want to step back and talk about how happy I am to be on this panel with right in between a midwife and a doula. And Senator Miranda talked about this a little bit, but the fact that these two models, midwifery care and midwives and doulas are often grouped together and they're often conflated. So just to be clear, right, midwives are providing that clinical health care and doulas are providing that wonderful support and information and staying beside families. But there's a reason I think that I'm personally so passionate about midwifery care and doulas, and that these two models, these two approaches were really centered in the maternal health law, and that is the time that they spend with their clients, the relationships that they build, and how they support our agency and our autonomy and our own decision making about our bodies and our care and our expertise about ourselves and our desires, because those things are inextricably linked to our health outcomes. You can't just be talking about these sort of metrics that we might use around maternal health or infant health without providing respectful care. I mean, we're not going to change those things until the care is respectful and people are treated well and not experiencing racism in their care or coercion. And so I am so happy that Massachusetts has recognized that the legislature is recognizing that, and that we have, and the Department of Public Health is recognizing that, and we have this opportunity to build up these models and access to these folks, because I hear my own experiences, and I hear all the time from people talking about, you know, why they care about having a midwife and having a doula, and it's, you know, they know me, they see me, they listen to me, they respect my decision making, they know my family and my culture and my traditions and my hopes, and that's critical, and that's what people want out of their care. And so I'm really excited for the opportunities we have for that to be the norm that everyone's experiencing in their care.
Thank you.
I think there's a lot to be celebrated in this moment, and it was so helpful to hear from Senator Miranda just, you know, how much work it took to get here. So I certainly don't want to diminish the monumental win that we have here in Massachusetts. I think particularly as a birth doula, I'm most excited about the increased access to doula care that women across the state get to have. As someone who focuses pretty much exclusively on serving Black and brown birthing families, I think it's a huge, huge win that Mass Health is now covering doula services. So a lot to be celebrated, and also a lot of work to still be done, as I think we've heard all across. You know, the reality is that there's still a lot of big gaps, and I serve as a servant leader on the Greater Boston Birth Equity Coalition, and as I've had conversations with my colleagues there, one of my fellow servant leaders, Soraya DeSantos, she beautifully put it, a legislative win is not liberation, and it really isn't. My other colleague, Katia Powell-Laurent, talked a lot about implementation, and how implementation is the opportunity where systems have the chance to either build equity or destroy equity. And that's what we're seeing right now. I think we're in this moment where the rubber really hits the road, or whatever the right saying there is. But implementation really matters. And there's just a lot of gaps. You know, as someone who is deeply in the community, there's trust gaps, there's awareness gaps, education gaps. As Emily just said, you know, I still have families that I serve that ask me, like, are you going to deliver the baby? I'm like, no, definitely not. So even though we've increased access to doulas, there's still a lot of education that has to happen with families so that they can really understand what's available to them. So lots to be celebrated, but lots to still work on. And I think a big learning is that community really has to lead and drive. So we have the legislation, but as we think about implementation and infrastructure, we truly need to be in community. And that's one thing that I'm really proud of with the Greater Boston Birth Equity Coalition. We're deeply committed to being in community. We're having an event this Saturday where we bring together lots of folks that care deeply about it. And I know a lot of people in this room will be there, but I would say it's a broader, more diverse set of folks that we bring into conversation with us. And our real goal is to kind of bridge that gap between what's happening up here at the policy level and people's real lived experiences.
Thank you.
Thank you. So I'm Rena Singh. I'm from the Blue Cross Blue Shield of Massachusetts Foundation. I'm very happy to be here, so thank you for including me. I too just want to take a moment to thank the birth equity community and DPH and everybody for the incredible work that has been done to get this bill passed and to implement it. I think in a time of challenge and stress and uncertainty, and I think we do recognize there is more to be done, it is wonderful to be here to honor what has been accomplished. The lessons for me, I think, as echoing what other folks have said, that really what I have seen in this process is the importance of relationships and community engagement. I think as Dr. Fitzgerald mentioned, right, just that open door, how everybody's been working together and trying to talk more. I see it as somebody who is new to this space compared to many other folks in this room, that I just see people who continue, and as I read things and go back and look at other things, go back and look at reports, who was in the room for community meetings. And this community has continued to show up, whether it is a community venue, whether it is a meeting with state leaders, whether it is a hearing, whether it is a work group to implement. And I just think that is incredible. And I think as we will talk about later and have mentioned, that is continuing, that is going to be needed as we go forward. So using those relationships, continuing to build on those as we go through implementation. Because I think as we, just as you said, Awara, like really this has to be implemented and done the way that is intended and is best for community.
Thank you so much, everyone. And I couldn't agree more with everything that was said. And thank you so much, Emily, for giving us a distinction between doula and midwife, because I myself use it sometimes. Actually, in the Shiras, like Danubia, they're not the same thing. It's like, oh, sorry. So thank you for clarifying for all of us. And but my next question is to Aurora. What from the Greater Boston Birth Equity Coalition was designed to be a driving force in shaping a community-led vision for birth justice. How has this collective work influenced the ecosystem since the bill's passage?
Thank you. I think it's really just elevating the importance of community voice and how critical it needs to be for community to take the lead in this work. There's been a lot of trauma that folks in the community have experienced. So when we think about kind of implementation, we need to take account for that and also understand the realities of when you are working in community, it can be slow because we have to move at the pace of trust. So I think those are some of the big things that have come up in our work. The Greater Boston Birth Equity Coalition, we are a group that represents various aspects of the community. There are 9 servant leaders. We are public health advocates, doulas, parents, researchers, community leaders. We kind of represent a lot of different backgrounds, including the community itself as well. And we have sat in the community. We do it every quarter. Like I said, we're doing an event this Saturday from 2 to 4 at the Roxbury Public Library. You all are invited to join us. But we take those opportunities to sit with the community and co-create what our priorities are going to be. We share resources, we share stories, and there's a real focus on co-creation. And one of the things that has come up is this real desire around decolonizing our access to maternal health resources. We are so blessed to be in a state that has a lot of resources, but again, I continue to see the gap between what's available and what people understand to be available for themselves. And beyond that, what's actually culturally reverent, what's linguistically appropriate, and what honors ancestral wisdom. So we are embarking on an initiative around building essentially what we're calling a birth equity directory. It will likely take the form of an app, but we're co-creating this with the community in an attempt to recognize that there are a lot of resources, and particularly the ones that honor ancestral wisdom are not always widely available across the community. So we're working with the community to kind of build a system where we can compile all the resources and have it be an opt-in process, have it be a community validated process, and kind of expand the access to resources that are relevant for Black and brown birthing families.
Thank you so much, Aurora. And beyond the coalition, you also advise and fund in this space. How are you using those roles to shift power and resources toward community leadership and sustainability in birth equity?
Thank you. I wear a lot of different hats, and I feel lucky to kind of be in a few different rooms. So in my hat as a consultant, I work with a lot of small community-based nonprofits, primarily in the Black maternal health space. And I help them on things like strategic planning and fundraising. And I feel like I get to be shoulder to shoulder with these brilliant, amazing community leaders that are truly trying to have deep impact for Black and brown families across the state. On the other hand, I manage a small philanthropic fund, so I get to be in the room with amazing funders like Rena, like Danubia. So I see myself as a bridge between those two different rooms. So with my nonprofit leaders, it's really about helping them understand, how do you play the game of philanthropy, which at the end of the day is still a game. Despite great intentions and a lot of good that's happening, folks don't know how to navigate those systems. And then when I'm in the room with funders, I try to bring some of the lived experience and reality of what it is to be an executive director or a community leader that has a very little team or no team, a very little budget or no budget, as they try to do really impactful work. So just kind of sharing information on both sides. I try to be an agent of change where I can. And I think that philanthropy as a field, we are moving more towards this trust-based model. And I know amazing folks that work in these institutions, both of you included, that are doing the real work. And there's still many more that have not updated the way that they work with community-based organizations. So I feel really privileged that I get to be in both of those rooms, and I try to take advantage of that.
All right, thank you so much for sharing that. And now we're going to go to Ginny. The bill promised to, and you mentioned that in your beginning comments as well. You know, it promised to strengthen access to out-of-the-hospital birth options and support midwifery as a vital part of maternal care. But what has this past year revealed about what's happened? I mean, you can go a little deeper, because during our prep call, you mentioned some things that you didn't mention today. And you can be real with us, right? And to ensure that these birth centers can not only open but sustainably thrive across Massachusetts, and what kinds of structural or financial supports still need to be in place to make that possible? In other words, like, what do you need? What are the solutions? Like, how can we help?
Well, it would be nice if nationally birth centers had a system of coding and billing that was more universal, because every state, every insurance company bills and accepts claims in different ways. And if you drop a modifier or you forget of this, it's denied. And so then there's all this people power to go back and do that. So we spend a lot of effort on just getting money. And what that means is a lot of times we're getting less than Mass Health pays us for private insurance. And we fight and work with credentialing and contracts with insurance companies, and it's very hard because it's not respected what we're doing, and we're too small to have really much power with it. If the part of the bill saying that midwives should get equal reimbursement is from MassHealth is a good start, because even though you cannot run a business with only MassHealth clients because the pay is less, it's better than many of the private payers are giving us. So if we can up that part and then work with insurance companies to value what we do. And it doesn't seem to be convincing when you go and say, our cesarean rate is low, we don't use epidurals, we don't spend money, we were saving you money. It doesn't have any power. It doesn't go anywhere. I'm spending hours and months. I've got one insurance company I've been working 10 months with. Got another one for 6 months. And it's this round and round negotiation where, no, we're only going to pay you what MassHealth pays you, and we're not going to pay you any more. Well, we can't exist on that. So a lot of it is, legislation that at the minimum, private payers have to pay us what MassHealth pays us. And then ideally, appropriately more. So the bottom line for us is we've got the building, we've got staff, we've got a waiting list till June. Every day we're turning people away. Mercy Hospital in Springfield just closed, so their whole OB unit is, so we're getting an influx of people, families that don't have care. And Bay State's overwhelmed, Cooley Dickinson's overwhelmed. We can't take that many of them because physically and what we've already taken, so it's going to be difficult for many families. And we can't get any bigger. We're as big as we're going to get. So that, if I could pay my staff a decent wage that's somewhat equivalent to what the hospital would pay them, if I could get paid, if we could figure that out. It's really, all of what you've been saying about what the bill does is spectacular for the state and kind of overlooking, and for people and families. In an individual situation as a small business with dealing with insurance and malpractice, we're struggling.
Thank you for sharing. And, like you've shared, you don't want to be a Debbie Downer, but we need to be grounded, right? Yeah. This is celebration. This is a win, but we need a reminder there's still a lot of work to do for us to achieve our vision. So thank you so much, Jeannie, for always keeping us grounded in reality. I am a person that I'm always wearing pink color glasses, so I need a Jeannie and an Antonia in my life to make me come back to reality and not just be in the dream world. But Emily, advocacy was critical, right? On getting the Momnibus bill across the finish line. Now that this historic legislation has passed, what does advocacy like in this next phase? When, if ever, is the work considered done? And then what remains unfinished to ensure that the promises of this bill are fully realized for all birthing people?
Thanks, Genevieve. I think it really echoes, what we heard from Elaine and also Ginny, that a lot of what the law did was remove some barriers and open up possibilities and opportunities. So possibilities to open birth centers with appropriate modern regulations that are more enabling, to have licensed certified professional midwives and have them be able to be reimbursed by insurance and Medicaid. But now we need to build things and we need to sustain them. And so that, as I said, that I didn't even get to sit back for, a month before that became really clear that that's what's next, and it's urgent. We have no time to lose. So, I'm thrilled that Elaine Dr. Fitzgerald Lewis talked about the funding for birth centers and for maternal health grants. And so, on the advocacy side, it's been really rewarding to partner. Bay State Birth Coalition partnered with the Mind the Gap Coalition for a shared slate of budget priorities for the current fiscal year budget, so in the spring. And I think that's where both the Commission on Racial Inequities in Maternal Health and then the fact that we have an omnibus bill that brought together midwifery, doulas, mental health, lactation, allows us to keep going that way and keep working together to achieve more. And so, we're able to get more funding for birth centers into the budget, funding for maternal mental health grants. So that's one part of the advocacy, and we really have to keep our foot on the gas here. And then the sustainability part. So we have another bill pending, and if anyone's not busy after this, I'm going to be heading to the State House. You can come with me. But we have another bill to address the issues that Jenny's been talking about regarding reimbursement for midwifery care, for certified professional midwives, for certified nurse midwives, for birth centers, and also to invest in growing the midwifery workforce and having the diverse workforce that we need. The systems in place, Jenny got at this, the systems in place now, they place value on medical interventions, physician care, C-sections, so surgeries, neonatal intensive care, all things that we need and should, of course, value, but they undervalue the types of things that midwives do and the things that doulas do, the time spent getting to know people, building that trust, things like nutrition and breastfeeding support, promoting health and preventing the need for a C-section, non-medical pain relief, water, massage, music, meeting the social emotional needs involving partners and siblings and family members, incorporating cultural traditions. These things take a lot of time. Midwives spend so much time and doulas spend so much time with their clients, and they are not compensated for that. It's a system that's really relying on the goodwill and very often the free or undervalued labor of women. And that's what we really need to change. What would it look like if we were actually compensating people and had a system that was compensating people and valuing, the type of care that supports our humanity, that we really can, home visiting, that's part of it too. And so we need to fund that, we need to reimburse that, such that, we're really cherishing our families and birthing people, and they can be, held and supported. And these amazing people that are working so hard and giving so much actually can be paid and take time off and be also nourish themselves so that they can do all that giving. So that's what we're advocating for now. So, building on those relationships, keeping it going. Someone said that midwives, or that the birth equity community, maybe it was Senator Miranda, said that they keep showing up, maybe it was you, that they show up to give input and feedback on regulations, on laws, on implementation, and that's true. And we have that reputation now because we've been showing up for a number of years. So it's getting people's attention. It's what got the law passed. It's a big part of it, and that's what we can keep doing.
Thank you so much, Emily. And again, if you're free, please follow Emily to the State House. And then, so Rena, philanthropy plays a unique role in systems transformation. How do you see philanthropy's role across systems change continuum, from shaping the conversation to supporting advocacy to sustaining implementation once a bill becomes a law? And I'm going to ask the follow-up question just to be mindful of time. Is please tell us a bit about the Commonwealth Funders for Birth Equity Collaborative and how it's working to support birth equity. Guys, this is the first time we're talking about this publicly, and I'm so proud of ourselves. So that one, I had to put it in there. So Rena, take us away.
So I will be quick so I can get to that. So I think the short answer is philanthropy can be involved in numerous ways required for policy and systems change. And actually, Emily just took everything I was going to say, so which is great. So I think it's it's how do we support at all the steps and in the ways that we can, right? So is it supporting community organizing and engagement? Is it supporting policy and research work, communication strategies, coalition work? What else? Making connections between stakeholders, introducing folks to other funders, showing up in rooms like this so we can get to know all of you. There's so many, those are the ways, and it can be financial and non-financial, and I want to be honest about that. I think we realize, right, yes, we have grants that we can give out, and yes, those grants are limited. But what are the other ways? I know for us, and I think I can speak for Danubia, is like, are there other ways that we can be helpful or show up? And that conversation and that door is always open. And so please let us know. I think we're happy to help wherever folks think we can be helpful. And then just to echo that the implementation, which we have talked about, the implementation phase and supporting the work of the organizations and individuals doing that is critical. We cannot walk away just because the law has been passed. I come to philanthropy from a health policy background and health advocacy, and so personally, like, I am right there with you. Like, I understand that this is not over, that we are in the hard work. And so I think anything we can continue to do to support that work. Two, what Danubia is very excited about is our Commonwealth Funders for Birth Equity. This is a collaboration of philanthropic funders and donors committed to improving perinatal health outcomes and advancing birth equity in Massachusetts. We started meeting kind of informally over a year ago.
Yeah, April
of last year, yeah, as we were exploring the space, and we started, honestly, we were talking to folks, we were talking to all of you, and have you talked to this foundation? Have you talked to this person? You're all asking kind of the same questions, and I don't know if you know each other, and guess what? We didn't. So we started to come together informally to share what folks had been funding, what they were interested in funding, looking to learn, really with the goal of sharing information, learning from each other, figuring out how we could be more collaborative to maximize our impact. And so we now have a formal name. This collaboration is mirrored off existing funder collaborations that already exist in Massachusetts that Danubia has also helped to lead. And our goals are to build, activate, and sustain a values-aligned philanthropic collaborative. And our second goal is to bring greater visibility, access, and influence on perinatal and birth equity. And we're doing this again by sharing information with each other, learning together, and then supporting local leadership and community solutions.
Thank you so much, Rena. And I know we have less than 5 minutes now, so I think I have space for one question. And if you have a question to DPH as well, they have a microphone and they could answer it. So, and I'm going to come back to this space here because it might be easier for me to see and not have my back to everyone. But there's a question right there. And I can see the clock from here too, so. Not this clock, that clock.
Hi, my name is Deandra Williams, and I'm from the Boston Public Library. So I'm excited that you'll be at the Shaw Roxbury branch on Saturday. But I have a question, and it's in regards to what's currently happening with our federal government. And so understanding that potentially knowing that like our health policies could be impacted, funding, things of that nature, how do you think that this is going to play a role in the current work that you all are doing? And then how also too is how is Massachusetts able to kind of prepare for this with all the work it is that they have been doing? Since that's a very real concern. And Dr. Fitzgerald Lewis, you're welcome to chime in. But that's just my overall question.
Do you want to join us up here? So that way people virtually can see you. Well, can you hear me okay? Oh, one more time. There you go. Can you hear me okay? Yep.
Is she on 4?
All right, perfect.
Hello?
Yes,
Oh, hello.
there you go.
Okay. Yes, that is the million-dollar question, probably. How do I summarize this? There is a lot that this administration is doing that is making it that much more challenging for us on a daily basis. With that being said, the commitment that you see here, the commitment that we have across the department and sister agencies allows us to be able to basically weather many of the nuances, the noise that's coming down from the federal government. Some of that, my bureau is primarily dependent on federal funds. That means that when there are cuts to things like SNAP, and even though we don't oversee SNAP, we oversee WIC, right? And so we are part of a large system. That means that we know that WIC families are going to be increasing their redemptions of their benefits, which is wonderful. And what do we need to do to continue to support them? We know that more families are hurting as it relates to the cost of living. So how is that impacting the other programs? So we know that families are actually, there's this tension between fear of accessing programs because of ICE and everything like that, and going out into the community, while also a great need for it. And to me, part of what inspires me every day in the programs that we have is that they're supported by passionate, committed human service providers, like the maternal and child health advocate and practitioners that have been doing this for their entire careers. They're going to keep showing up. There are still babies that are born every single day, and mothers and families that need support. We are still showing up. And we're supporting programs at the community level, like home visiting, like early intervention. All of these different initiatives, they're based on the trusting relationships that providers have with community members. So it's leaning into all of that to support families and continuing to show up, because that's all we can do. And I am very grateful to be living and working in Massachusetts, where we have an administration that is in line with continuing to do the hard work and not be afraid of using words like equity and dismantling structural racism and still showing up. And we are operating under constrained fiscal climates with the government shutdown and everything that trickles down, even here in Massachusetts, and still we're going to show up. So I don't know if that answers your question, but I think for me, part of it is that we have such a tremendous team, both within the department, but then all of you, that allows us to keep doing the work and finding different ways of just navigating the system and not stopping regardless of the noise. And there's a lot of noise that we get pulled into. Different exercises, different contingency plans, just because of all the crazy executive orders that are coming underway. So I'll pause there. I see the 1 minute.
All right, thank you so much. And as I've been warned, we have 1 minute. I want to say a special thank you to our speakers and presenters, to Liz Miranda, Senator Miranda. She's not here anymore. Also to our audience online, thank you. I know there was a lot of people that RSVP'd, but mostly online as well. You missed out on great breakfast. There were Brazilian coxinhas, but hey, we ate it. But thank you so much, everyone, for being here. And I want to finish us off with something that really stood out to me, is that yes, I am in dreamland, I am in La La Land, I am eager to get to the vision, but then there is the reality. And we will only know if the work that we do is truly equitable if we are transforming experiences of the people. We can tap ourselves in the back all we want, saying we're doing a great job, but if the person that we are serving is not feeling it, then the work that we are doing is not transformative. And how it will be transformative is by listening to community, is by listening to people. Although it's hard to hear, oh, the way you spoke to me was not culturally sensitive, it's gonna hurt. Feedback hurts. But I think it makes us so much stronger to listen to that and be committed to improvement and in improving the services that we're providing. This is not a paycheck. If you're in this job for a paycheck, Jeannie told us this is not the place to be. But this is an opportunity for us to do, this is hard work, but it's also hard work. So let's always be committed to transforming the experiences of those we serve. One movie that always inspires me, one of the quotes is, if you cannot be kind, don't speak at all. So always be mindful to be kind to everyone, and always go above and beyond to make sure that that person engaging with you is having a transformative experience. Historically, our Black mothers, Black birthing people, have not had a positive experience, not just birthing experience, but in everywhere we go. So we did not create this mess, but we have the responsibility of undoing it, of fixing it. And systems are not designed to help and to do the work that it's supposed to do. But one of the things that I don't get tired of saying is systems are made out of people, and we are the people. Thank you so much, everyone. You have a great rest of the day, and there's a lot of work to be done. This is just the beginning. And let's take pictures, you guys, if you want to wait. Is Sam still here?